How's it going, everyone? Welcome back to the channel. Just came back from work again, and it's been a busy week. We're coming up to the end of the summer right now, and typically where I am right now, rural Canada, the tourists kind of increase in number towards the end of the summer because everyone wants to go and see places before it gets cold. So these last couple weeks and these next 2 weeks are probably going to be the busiest that we're going to be here for the rest of the year. So I posted that last video doing a Dr. Glaucomflecken reaction a couple of weeks ago, and I wasn't going to do a second one, but so many people were so passionate about that video, so many people liking the video, commenting, really just wanted to share their stories and experiences with rural medicine that I thought we'd do one more here today. So we are going to be reacting to the farmer pain scale, and just going off the title and seeing the thumbnail, I know exactly where this is going. A lot of people wanted me to check this one out and give my thoughts about it as a rural medicine resident here in Canada, and that's exactly what we're going to do. If you don't know who Dr. Glaucomflecken is, you have to go check him out. Leave a like on this video. We're going to get started with this one right here.
All right, go ahead. What do you got? We got a 68-year-old farmer. He was building a fence and started noticing some back pain.
Quick pause. One of my favorite things about Dr. G is that he is able to make himself look younger or older depending on the character that he's playing, and that med student really reminds me of me. Every time I watch one of these, I never really wore a white coat when I was on rotation, but anything that you could do as a med student to make yourself look like you belong in the hospital a little bit more than you actually do, because it's awkward at first, right? So that clipboard, especially looking up and down, and it just any props that you have to make yourself look a little bit more official. It's crazy because I was only in med school like 2 years ago at this point, but even though I don't think I look that much different, you could really pick out, if you're a patient, you probably know this too, you could spot the med students, and it's the uncertainty and the lack of experience, and he captures that really well.
Wife make him come in? No, he came by himself. He's alone? Yeah, he was worried, so he came right in. Hey, Peggy, wait!
This is so true to the point that as a doctor working here at the emergency department especially, more often than not, a lot of patients that are male, and males get a really bad rep in medicine in terms of minimizing pain a lot of times and really not wanting to go in to see the doctor for any reasons really. But they bring their wives a lot of time, or their girlfriend or anyone else. And I do this too when I go places with my girlfriend. But as a doctor working in the emergency departments, guys, I really appreciate it when you bring someone else in with you, whether it's your wife, your girlfriend, a family member, because sometimes I ask you questions and you're sitting there shaking your head going, no chest pain, no headache, no shortness of breath. And I turn over and look at your partner and they're like, yeah, there totally was. And this is not normal for them.
We got a farmer who came in voluntarily. What else did he say? Well, I asked him to rate his pain on a scale from 1 to 10, and he just said, I'm here, ain't I?
This is exactly what I'm talking about, right? The whole pain scale on 1 to 10, it doesn't actually work because, especially here where I am, right? The average wait time for the emerge could be like 7 to 10 hours in some cases. People don't want to be there. So I found the more that I'm working that if you're not here, that means that you could handle it at home. But if you're here, it's pretty painful. And the whole 1 to 10 thing, the better question to ask is, has this gotten worse since you got here? Especially if you've been waiting about 5 hours. One important thing to know though is every single person that walks in there gets triaged, and we hear about you when you first come in. That way we know in our head who needs to be seen right away and who we need to look out for, because they're going to drop at any second. And one of the things about being in a rural area is that the populations of all these places have exploded in the last few years as people are moving out of the cities into the country, get away from the hustle and bustle, and you could work online and a few other things. But even though the population's exploded, the amount of doctors working out here has stayed pretty much the exact same, or decreased in some cases because people are retiring. So the wait times are horrible in some cases, no other way to put it. But we are always keeping our head on a swivel, and it keeps us in like perpetual fear for the first couple months that you're working, because you really just want to watch out for everyone and make sure you always know what's going on at all times. And then eventually you learn to pay attention to certain cues and who needs a little bit more attention, and that's what we're looking for when you come in.
Yeah, that's all he said. I don't know what that means, though. That's because you're using a pain scale for normal people. You got to use the farmer pain scale. Is he going to be okay? Listen to me carefully. Did he finish the fence? No, he had to stop. Dear God. Peg.
I love when Dr. G's, whatever character, the pause and the dear God, because it really just shows, listen, not much could shake a well-seasoned rural medicine or emergency medicine doctor, but there are a few things, and this is one of those things. So I'm always really careful to share stories here, but I will say that there have been multiple times over this summer where someone came in for something. Let's give a good example, an infected wound that I saw one time on someone's back. And this thing was necrotic. And there were different colors of sloughed off tissue in there, and he definitely needed to be seen by a general surgeon. And when I told him that, his first response was that he had to get going back to work and he had been waiting long enough. And if the general surgeon was there that day, we don't have a general surgeon at our hospital. The nearest center, I told you guys last time, was like 35 minutes away. So the process is, if you need to consult surgery, you pick up the phone, you call them, they're probably operating, you hang up, you wait for them to finish, they call you back. From the time when you see the person and you decide you need to consult general surgery, it could be another like 2 hours in some cases before they're able to call you back. And anyways, this person ended up leaving AMA. And I tried my best to get a hold of the surgeon later on, and we got the guy's number, but it was definitely not something that I wanted them to leave for, but they had to go to work, and that's understandable, right? Because sometimes, like right now, we're going to get snow really soon, and you're not going to be able to work in the wintertime, so people got to make their money now. And I get that, but you got one doctor in the hospital sometimes, and then surgeons are busy operating, and they're in a totally different center, and that's what we got.
Get the crash sack ready. It's going down. What's a crash sack? Well, we had a crash cart, but we had to repurpose it as a hospital bed, so we just stuffed everything into a burlap sack. Hey, Doc, Jim Bob's on the...
This one's really quick. Hopefully some of you may know what a crash cart is. I've never seen a crash sack before, but crash cart, you could look it up online. It's a cart. It's got wheels. You could wheel it from one room to the other. It's got a whole bunch of different medications and medical devices that you would need in case of an emergency. So some things we stock on there, all the different medications from the ACLS algorithm, anything you need to use to run a code, different things for intubation, EpiPens should be in there, different things for traumas. I believe we have a tourniquet in the bottom, although I didn't have to use it this summer, thankfully, but yeah, that's it.
Oh, and he cut his hand. He thinks it's infected. Hey, I don't have time for this. I got a farmer here who quit chores to seek medical care. Well, he's been using Delilah's antibiotics. She had mastitis last year. He just wants a refill.
That's exactly right. Most people, in my experience, true farmers, don't come in with just a cut on their hand. Many people, they keep like a first aid kit with them, and it's a pretty advanced first aid kit. Like, it's not just rubbing alcohol, although that's usually a component of it. And many people won't come in and see me for an infected hand. They definitely can, or see their family doctor, but when the wait is that long, they are going to try and treat it themselves. And it's not an exaggeration. This is true. People have told me that they've tried to take antibiotics that were prescribed for animals. I wouldn't recommend it. This is not me endorsing that at all, but it happens. It very clearly happens.
Lila, his wife? No, it's his dairy cow. Can you call Leroy with this? I got a situation over here. I tried. He's in the middle of a root canal. Leroy is the dentist? He's the dentist and the pharmacist. Hey, Peggy, can you tell Texaco Mike to go ahead and get...
I don't want to give away too much. But yeah, I know people, first of all, really great people, by the way. In the Niagara region, we have an emerge doc who was first a veterinarian and then stopped being a veterinarian, went to medical school, became a emergency medicine doctor. And there are definitely people that are very well trained outside of their own domain. And yeah, in small communities, you hear stories all the time about the dentist also being a vet, or the vet also seeing people in terms of minor cuts and abrasions, and sometimes not so minor. But I've heard stories. I haven't seen it myself. I've never actually come across a veterinarian here that was treating people in emergency contexts, but people have left it in the comment section, so let me know if you've ever seen that happen for real. I'm really curious.
Let the fan boat, please. Is Leroy a pharmacist for humans or animals? Do you think we have two pharmacists here? Yeah, go ahead and fax him. It might take him a while to get here. Hey, Doc, Jim Bob called back. He said never mind. Great. What? What's wrong? When a farmer calls asking for help, you gotta jump on it right away. If you wait too long, he'll say to hell with it and you'll never hear from him again. Really? Hey, what did Jim Bob say when he called? He said to hell with it.
And as I was saying before, it's a fault, okay? This is not a good thing. I'm sitting here, I'm laughing. I'm sure you guys are all laughing at this short. We laugh because we know people that this has happened to. This is a real thing that happens. Dr. G is well in touch with rural medicine. I don't know if he ever did a rotation in rural medicine in his ophthalmology residency, because he seems like he's too well known in terms of the rural medicine sphere. Like he definitely probably spent some time going through a rotation like that. But a lot of times these people wear it as a badge of honor to not seek care, and they're very to themselves, and it's live off the land and treat all of their emergencies themselves, and really only seek medical attention if they're on death's door. And that's not okay. Like we shouldn't be in a situation where that needs to happen, but unfortunately it does happen. And I can't blame people. All I could do is advocate that if you need medical help, come and see us in the hospital. We're all trying our best. I know you guys are trying your best too, but sometimes you need help, okay? So that's the end of the reaction video for today. I just want to, end it off one more thing. This is my last week here in this community, and to anyone that's from here or has come and seen me emerge, it's not, there have been people that told me that they saw me on YouTube, and that's still crazy to think, and it's like a really sketchy line for me to be walking there, but being here the last 2 months has been amazing. So many people really just welcome me into the community. Like everyone here is amazing, and it's a feeling that's really unique to small towns, and I love that about this place. And anyways, thank you to everyone that let me help you out this summer, and thank you to everyone working in rural communities. And we need doctors out here. I'm trying to push it out to other people. If anyone is interested in rural medicine, go out and spend some time there. You're gonna fall in love with the community, I think. Anyways, but my next rotation is 1 month of emergency medicine back in a smaller-ish town. It's in Welland, and then I'm doing ICU. I'm back on OB. Then I'm doing some sports medicine, some more emerge. It's a busy year for me, but it's coming along nicely, and I really love what I do, in case some people wanted to know my thoughts on rural medicine. We'll see you all in the next one. Leave any questions, comments you have down in the comment section below. I'm gonna go take a nap because I'm pretty tired. But anyways, good luck, everyone. See you around.